Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health, reporting for the week of January 20th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. After an update on COVID, RSV, and the other respiratory transmitted illnesses out there, I will provide an update on MPOX and talk about the potential withdrawal of the United States from the World Health Organization. Quick reminder, if you haven't yet completed our survey about the briefing, we'd really appreciate your feedback. We'll have it open for the rest of the month, and the link is in the post. Starting off, taking a look at the weekly percent of tests that are positive for the various illnesses that are transmitted by the respiratory route, we can see that clearly influenza is doing the most right now. When you look over to the far right, we can see that influenza is at the top, meaning that it is comprising the greatest proportion of the positive tests that are being done right now, so almost 20% of them. And also it is still heading up, though not quite as sharply as it was before, but heading up nonetheless. And you can see that rhinovirus and some of the common cold viruses in the gray, it's heading down, but still making up the second largest proportion of positive tests. And then third is RSV, followed by COVID. And we can see that RSV and COVID and also other coronaviruses that cause the common cold all seem to be heading downward. Human metapneumovirus, which is at the bottom in black, still not causing a lot of illness, but it is heading up, and this is certainly normal for this time of year. And these data are as of January 11th. And remember, we're going to take this graph here with a big grain of salt because we know that so many people get sick and never get tested. We also know that we now have convenient COVID home tests. So presumably most people who test positive for COVID at home are not going to even present to the doctor to get a test. So this is definitely a subset. People sick enough to get tested, people who don't otherwise know what's making them sick but want to or need to go get care. But assuming most of those variables are stable, I still like to look at this graph just to see what direction things are heading. And now taking a look at SARS-CoV-2 in the wastewater, this is some good news in that it is looking like it is coming down in every single region. Of course, these are huge regions, so where you are specifically may be looking different. If you're interested, you can check to see if there is still wastewater sampling in your area. But generally, it appears that things are coming down. Of course, we know that the gray shaded area to the right is still preliminary, but still heading in a good direction. Having said that, the nation on average, which is the black line, is still considered in the high category. Nowhere is low yet, but hopefully we'll get there soon. We also have some good news on emergency department visits. Although influenza in the blue got pretty high there, it looks like it started coming down around December 28th. And this graph is also showing us through January 11th. So a couple of weeks of trending down of influenza. Also, COVID and RSV seem to be headed down from January 4th to January 11th. And I'll talk a little bit more about what this might mean in a moment. And taking a look at severe viral respiratory illness, so that will be hospitalizations and death. And remember that beginning on November 1st of 2024, it is now a requirement for hospitals to report information on COVID, flu, and RSV hospitalizations and bed capacity. And what we see here is that nationwide, with around 90% of hospitals reporting, looks like things may be trending down as well. This is looking at from January 4th to January 11th at the end of the graph there. And again, with that caveat that the gray shaded part is preliminary, but still appears to be heading down for all three. You can look up your state if you're interested in this, and the link is in the post. And some states are not reporting enough, so under 80%, and you'll be able to see that as well if you select your state. And I'll also show a map in a moment that will give us some more context on this. But first, let's take a look at deaths. Starting with COVID deaths, we can see that we have been back up over 500 deaths per week since the week ending December 14th. And unfortunately, it does look like we're likely going to be headed back up from here. Now, if what we're seeing in the wastewater and the emergency department visits holds, then hopefully this won't go up for too much longer. But still, over 500 deaths per week is way too many. We need to be doing better at using what we've got, which is our best practices to reduce the transmission, as well as the tools we have to reduce bad outcomes. So vaccine and then testing plus early antiviral treatment, particularly for those at risk of a bad outcome. And if we take a look at the percentage of deaths that are due to COVID, flu, and RSV, we can see when we look far over to the right that those last several weeks, we're really starting to see those flu deaths come in, and those are in blue. We're still seeing more COVID than flu deaths each week, COVID being in the orange, but essentially we're now contending with both, and also to a much lesser extent RSV. So remember, we have vaccines for all three of these. So we should be following the guidelines in order to avoid what are oftentimes vaccine preventable deaths. Now taking a little closer look at flu, this is looking at this flu season so far, taking us through the second week of 2025. There have been over 12 million illnesses, and that's up from the 9 million we reported last week. 160,000 flu hospitalizations. That's up from 110,000 reported last week, and 6,600 flu deaths. And that's pretty significantly up from 4,700 flu deaths that I reported last week, including 27 pediatric deaths so far this season. And the best way to protect yourself and your loved ones, your children, is, of course, the flu vaccine. And I went over in some detail how the vaccine seems to be performing this year. So if you're interested, that was in the briefing 2 weeks ago. But bottom line is, best way to protect yourself is the flu vaccine. And also, if you start having symptoms and are in a high-risk group, getting started with antiviral treatment right away is going to be your best bet. Now, I mentioned wanting to give a little further context to what it means to see the COVID, flu, and RSV heading down right now. So first off, we know that oftentimes with influenza, we actually can see two peaks during the season. For example, we could have a peak in December and then have one again in February, and that is not uncommon at all. The other thing we can see happen is we might have our flu A, influenza A, peak earlier, and then have an influenza B peak a little bit later. That's something that we've come to expect, or at least not be surprised by with influenza. So the fact that influenza is coming down right now is great, but it would not and should not be a surprise at all if we did have another peak as we get further along into the season. Now, of course, even if we've already reached the peak and we're not going to have another peak and we really are coming down for this season, that means we're still only halfway there. So once again, if you have not gotten the flu shot yet, it is still a good time to get it. Now, as it relates to COVID and also even RSV, of course, anything can happen, but the pattern that we typically see is that once we hit the winter peak and come down, we shouldn't expect another winter peak. Of course, with SARS-CoV-2, we do fully anticipate another peak probably in the summertime. We've seen peaks in every season with COVID, and we continue to see COVID circulating all year round. But certainly if we don't have as large of a wave this winter, that would be great. Of course, we had a pretty massive summer surge this past summer. So particularly those who are eligible for the every 6-month vaccine, so older and moderate to severe immune compromise, this is definitely a consideration to avoid that summertime illness, is to kind of time that next COVID vaccine, because of course in the summer, we're mostly concerned about the SARS-CoV-2. We don't expect to see flu or RSV, really primarily SARS-CoV-2 that we're dealing with. I did also want to show what seems to be going on with COVID and flu across the country by sharing the map, and for that I will share my screen. So this is taking a look at epidemic trends, and this basically uses modeling based upon emergency department visits. And we can see here that it is showing that with SARS-CoV-2, that it appears to be declining in much of the country, which is this color here, and likely declining in many states. and really just not changing in the state of Texas, and a few states in the middle of the country here are not reporting. But for the vast majority of the country, we see that the trend is declining or likely declining. And this is consistent with what we were looking at earlier, where the wastewater is coming down and cases are coming down, emergency department visits are coming down, and even hospitalizations appear to be coming down. Now, on the other hand, when we take a look at influenza, we can see still a few states are not estimating, and many states in the gray here are not changing. But there are quite a number that are growing as it relates to influenza. So California, Texas, a number of states here in the South that are growing, and a bunch more that are likely growing in this lighter purple. And then we do have some that are declining as well, kind of across the middle here. And so this kind of helps to give a different perspective, and it helps to kind of reconcile where we saw that flu cases are actually still increasing, not as quickly as before, but we know that things are going to be a little bit different in different pockets of the country. And as I mentioned, there could be increases of type A or B or different subtypes of the flu in different areas, and we could even see more cases increase in the weeks to come. So this will just be something to keep an eye on. And I haven't shown this slide in a while. This is the variant proportions of SARS-CoV-2 in the United States. So this is showing what was actually observed on those top two bars for kind of the middle to late part of December. And bottom two bars are projections based on a model that helps to estimate variant proportions. And I haven't been showing this for a while because this is the no news is good news slide. And I'm glad to say that there's still not much news to report here. We are still primarily seeing XEC, which is derived from JN.1, and really all the current circulating variants are pretty much derived from JN.1. LP.8.1 is increasing, and it may have a mutation that might give it an advantage over XEC, but still seems to be closely related. And the vaccines that are out now are still a pretty good match for what we are seeing now. So hopefully it stays that way. We're definitely looking forward to getting data about the overall performance of the vaccine this season, and that will help inform what might be done as far as the vaccine next season. But for now, if you haven't gotten an updated COVID vaccine, now is still a good time to get it. And now I want to do a little update about MPOX because it is a situation that's progressing, but it seems like we haven't heard a lot about it lately. There have been a few scattered headlines about cases popping up in countries for the first time. So I wanted to make sure we're all up to date on the status and what it might mean for us. So what we're talking about here is a multi-country outbreak of MPOX Clade 1B. And remember, this is pretty different from the Clade 2 MPOX, which caused the global outbreak in 2022. And although the Clade 2 outbreak is still ongoing, we did have a pretty good concerted response. And even though it is giving us some trouble, it does seem to be less worrisome than the Clade 1B MPOX that we're seeing progressing right now. And this certainly is not to downplay Clade 2. We did have over 3,000 cases in 2024 here in the United States, primarily spread through sexual contact, particularly among men who have sex with men. And although death from Clade 2 is pretty rare, we have seen deaths, particularly in people with untreated or inadequately treated HIV. And remember that 2 doses of the Jynneos vaccine is the best way to protect from MPOX. We've done a pretty decent job in the United States getting the vaccine out there, getting the education out there, although we still do have a lot of work to do, including making sure that people get that second dose or else they're not fully vaccinated. But now on to Clade 1B, which is the one that we are much more concerned about for a few reasons. One, it does seem to be much more severe, more deadly, spread more easily. And the Clade 1B outbreak continues mostly in the Democratic Republic of Congo and Uganda and Burundi. And now we have cases popping up in countries where we have not seen it before that appear to be travel related. And also there has been some onward transmission from this. So this is one of the things that we should absolutely be concerned about and be keeping an eye on. So the first Clade 1 case of MPOX in the United States was confirmed on November 15th, 2024 by the California Department of Public Health. And this person seems to have had a smooth course and recovered fully from their MPOX. Not too long after that, there was a case in Canada. So Canada had its first case of Clade 1B MPOX in late November. There have been travel-related cases in Europe and Asia. You might recall that the World Health Organization declared MPOX a public health emergency of international concern back in August of 2024. And it was really the rapid spread in the Democratic Republic of Congo and onto neighboring countries that was concerning. So the fact that we still haven't gotten it under control and that now we're seeing cases popping up in other places definitely underscores this concern. There have been 6 cases in the UK, as well as cases in China, India, France, Germany, Sweden. So far, does not appear to be spreading locally in any of those countries, although one of the UK cases did have related household spread. In fact, the initial person who had travel-related or travel-associated MPOX then spread it to 2 people in their household in the UK. Now, I mentioned that Clade 1B is considered more deadly, and it is spreading significantly among children in the Congo. But it is worth noting that the fatality rate does seem to be very dependent on the context. So we just need more experience and more time to really be able to define this. Some of the areas that are being hit hard are rural. They're far away from medical care. They don't have access to treatment like we do in the United States and the UK and so on. So I don't think we have a complete handle on what the fatality rate actually is and how different it is from Clade 2, but we know that it is still very painful, disfiguring, absolutely can be deadly, has been deadly. We know that it is spread much more easily from person to person. So not just through sexual contact, it can even be spread by sharing air with someone. So aerosol or droplet spread. So this makes it additionally concerning. And I should point out that even though we are seeing good protection with the Jynneos vaccine, and there have been a lot of efforts to get the regions, especially of Central and East Africa, vaccinated, we really don't have treatment. We really don't have adequate antiviral treatment for MPOX. Remember the medication TPOXX or tecovirimat? This is a medication that we stockpile for smallpox preparedness. This was being investigated for MPOX, but unfortunately, so far, the analyses from some large randomized trials show that even though it was safe, it did not improve outcomes. So there is still access to tecovirimat for certain high-risk patients as an investigational drug, but unfortunately, so far is not looking too promising. Now, a big reason that MPOX was declared a global health emergency is to call on the world to effect a coordinated effort and a response that will prevent it from spreading and becoming a serious threat to everyone. And remember, even with the Clade 2 outbreak in 2022, that did significantly affect us here in the United States. That likely could have been prevented had we not ignored Clade 2 MPOX, which had been endemic in Africa for quite some time. And of course, there are many illnesses and outbreaks that have been in different parts of the world that can spread and affect us across the globe, as we unfortunately experienced recently with SARS-CoV-2. So clearly, we know, if we didn't know before, we should definitely know now how interconnected we are. We travel a lot, we do a lot of global air travel, and things can get out of control quickly if we're not paying attention and if we're not working together. And like I said, I think we've all unfortunately had firsthand experience of what this can look like. No matter how advanced our US healthcare delivery system may seem, we know that it can become overwhelmed. We experienced it becoming overwhelmed because we simply were not prepared for an outbreak of the magnitude of the SARS-CoV-2 outbreak. And we continue to feel the effects of that lack of preparedness today. So naturally, many of us are concerned that we will become even less prepared as we are hearing threats of the incoming administration considering pulling out of the World Health Organization. So this is by no means to say that the World Health Organization is without flaws or is a panacea for everything. We know that there are challenges, but I thought I would take this opportunity to just talk through it a little bit. The World Health Organization is a member organization, and its members are 194 member states, which are really countries, but they call them member states. And currently, the United States is one of the 194. I put a link to all the countries that are members in case you're interested, but it's pretty much nearly all the countries in the world. Although I will say that depending on who you ask, there are anywhere from 194 countries to 230 something countries in the world. This turns out to be a lot more complicated question than I had realized, but the vast majority of recognized countries belong to the UN and the World Health Organization, and at least for now, the US included. Now, what is the role of the World Health Organization? So the World Health Organization was founded in 1948 as a specialized agency of the United Nations with a mission to promote health, keep the world safe, and serve the vulnerable. So you might argue that one of the challenges with the World Health Organization is that its mission is very broad, and also its mandates are rather broad. It acts as a coordinating authority on issues of international health, and part of that is helping countries with responses to outbreaks and public health emergencies. It provides technical assistance to countries, and for some countries, this is really all they've got. It coordinates international responses to health emergencies. It helps to set worldwide standards and guidance on health issues. It promotes health and advocates for better health for all people across the globe. And we've also seen the World Health Organization holds international meetings and convenings. It also delivers emergency assistance, including in conflict zones. So they're doing everything from conducting vaccine campaigns to delivering medications, to preventing outbreaks, to addressing malnutrition. And in terms of their strategic priorities for the last several years, those have included what they call the triple billion targets, helping 1 billion more people benefit from universal health coverage, ensuring 1 billion more people are better protected against health emergencies, and helping 1 billion more people enjoy better health and well-being. And even though we think of this mostly in low to middle income countries, we would love to have more people benefit from universal health coverage right here in the United States, as well as being better protected against emergencies and enjoying better health and well-being, because we know that even though we are considered a high-income country, we have quite a lot of health challenges, health disparities, and uneven coverage. And for the amount that we spend on healthcare, our outcomes are actually fairly abysmal. So we don't have it all figured out. And so these all seem like pretty lofty goals as it is. And at the same time, new challenges keep emerging. So the job essentially keeps on getting bigger. The World Health Organization Director General, Dr. Tedros, recently said conflicts, outbreaks, climate-related disasters, and other health emergencies are no longer isolated or occasional. They are relentless, overlapping, and intensifying. Absolutely. So last week, the World Health Organization launched an emergency appeal stating that $1.5 billion is needed to the World Health Organization in 2025 to provide life-saving healthcare to millions of people in emergencies. And specifically, an estimated 305 million people will require humanitarian assistance in 2025. And the scale of the challenge is outpacing available resources. So the World Health Organization is seeking support. There's a lot of details about where that support is anticipated to go on their website, which I've linked in the post. Everything from this MPOX public health emergency we're talking about, to dealing with cholera outbreaks, to a multitude of humanitarian emergencies. And of course, all of this is happening while the incoming United States administration has signaled the potential for trying to withdraw from the World Health Organization. Now, in 2020, the Trump administration did temporarily suspend funding for the World Health Organization and started the process to withdraw, but then that was reversed by the Biden administration in 2021. Historically, the United States has been one of the largest funders of the World Health Organization, and this support is obviously critical to the mission of the World Health Organization, but it's also critical to our health and our security and our future. I know that many of us had very legitimate frustrations with the World Health Organization and the CDC for that matter around the SARS-CoV-2 pandemic response and communication, including unacceptable delays in admitting that SARS-CoV-2 is airborne. But there have been many important achievements that the World Health Organization has played a key role in. These include support during epidemic and pandemic responses, including MPOX, including Ebola, including Zika, eradicating smallpox, putting forward guidelines and recommendations around personal protective equipment for healthcare workers, frameworks around tobacco control, addressing malnutrition, responding to the HIV epidemic worldwide, to name a few. So I think there's no question that we need a coordinated global response to things that pose global health threats. It's not just about people's health and well-being in places far away from us. It has to do with our own preparedness, and it also has to do with global health security. The United States has been a leader in this, and its participation in the World Health Organization is critically important, not only to the World Health Organization itself, but also to us here in the US for the reasons that I've mentioned. If the US were to leave the World Health Organization, not only would it weaken the WHO, it would leave the US more vulnerable, and it would also mean that we would not be at the table, which means others could step in to guide things in a way that may not be as advantageous to the US. So this could mean other countries, this could mean significant donors with their own motives. And so if we are not at the table, we could be on the menu, as they say. So yes, we want the World Health Organization to do better. The way to make that happen is to stay a member and to use our influence to hold the organization accountable and make it stronger. So we'll just have to watch and wait and see what happens next. In the meantime, let's continue to do what we can to keep ourselves and our loved ones safe and healthy. If you don't have a primary care provider, please get one, develop a relationship with them, make sure you're getting the appropriate screenings and vaccinations based on your age and risk factors. Eat a balanced diet, quit smoking, limit alcohol intake, avoid sugars and processed foods and artificial ingredients. If you don't feel well, make sure that you get your rest. Otherwise, get some regular physical activity, get some fresh air, manage those stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. We will be taking next week off, so we will see you again on Tuesday, February 4th at 10 a.m. See you then.